Good day, viewers. My name is Dr. Brian Bogo. I am a medical officer in Western Family Hospital, and today I will be continuing the series that I started earlier called Diabetes Mellitus. Now, previously we had talked about what the disease is and what symptoms come about in this disease. Now we're going to talk about how it is diagnosed in a facility and also how it is managed. So to start with, let's start with how it is diagnosed. Well, essentially there are three methods of diagnosing this disease. One, we do a test called a fasting blood sugar. Now in fasting blood sugar, what we normally do is we allow you to enjoy your meals and whatever doings that you do in a normal day for roughly 3 days, and following the third day we ask you to fast from your last meal in the day for a good 8 hours or more. And beyond that, you come to our facility where we will actually test your sugars, and if we find them within a specific range, then indeed you do have diabetes. So that's test number one, that's fasting blood sugar. Test number two, we call it the oral glucose tolerance test. Now in this test, what we do is we give you a specific amount of sugar after having fasted for those 8 hours that I mentioned, specifically 75 grams roughly of glucose, and we tell you to ingest it, and we wait 2 hours. After these 2 hours, we take a sample of your blood and test the sugar levels. If indeed they're within a specific range, then you are deemed to be diabetic. And finally, the last test that we normally do is called the HbA1c test, or the glycated hemoglobin test. Now in this test, we just take a random sample of your blood, and we essentially look at the amount of sugar that's found in your blood cells over the last 3 months. And if the amount of sugar that's found is within a certain percentage, then you are deemed to have diabetes. Now, within our facility, we offer these tests, and they are quite important when it comes to diagnosing the disease. Now, moving on to management of the disease. Well, there are 3 ways particularly to manage it. One, we talk about lifestyle changes. Now, lifestyle changes involves changing diet, aspects of nutrition, and also involving yourself in exercise or physical activity for your health, of course. And secondly, we talk about the use of drugs, particularly oral anti-diabetic drugs. These drugs will be taken every single day, and they are used to control the amount of sugars that are in your blood. Some of them require that you take them before your meals, some of them require that you take them after. And this is totally dependent on the instructions given to you by your medical professional. And finally, we are going to manage it through the use of the hormone itself that I mentioned in the first series, called insulin. Now we use this insulin, and we pump it into your body either through injection or through a continuous pump, whereby it will continually control your sugars for you. Now, in our facility, we provide all aspects of this treatment. As for the lifestyle education, we have nutritionists that are available that will help you with a proper plan on how to go about your diabetes. As for the drugs, our well-stocked pharmacy has all the drugs available that are needed for the control of the disease. And finally, for insulin, we do have the source of insulin that can be provided for as long as needed based on your condition. I would like to stop the video there. Thank you for your time, and in the next series we'll talk about the complications or the long-term complications of diabetes. Thank you for your time. Farewell.